Hello, Dr. Cem Altindag.
Hi, I am very pleased to meet you.
Thank you. Can you tell please about yourself? How long do you do rhinoplasty?
For many years, yes, we perform surgery for more than 25 years.
Mm-hmm. And do you do rhinoplasty or other surgeries as well? Or
No,
you do only rhinoplasty?
We just perform no surgery. Primary rhinoplasty, revision rhinoplasties, and rather than rhinoplasty, we do nothing as the clinic.
Mm-hmm.
Our special interest is just nose. Also European Rhinoplasty Society certificate we have, and also the health tourism accreditation. We have the certificate for this.
Okay, great. Can you tell me please what kind of rhinoplasty technique do you use?
We prefer open approach rhinoplasty or closed approach rhinoplasty for selected patients. Sometimes we use piezo surgery, ultrasonic equipment. It's especially for broad side bones. It's advantageous. We sometimes use piezo surgery.
Do you see that recovery period is more fast with the closed rhinoplasty than with the open technique?
Yes, it's much more comfortable compared with open approach, but it's not a big difference, of course. It is difficult for the surgeon, but much more comfortable for the patient. Closed approach, but we cannot perform every nose via closed approach. Sometimes, many times, we need to open the nose and we need to work precisely, especially on the nose tip.
And do you know beforehand that it will be open or closed technique, or you learn it during the surgery?
Not during surgery. Mainly, we will be able to make our decision when the patient come for consultation.
Okay. And what is the recovery time and the restriction after the surgery?
Many patients can go back to their country a couple of days later, and sportive activities, Pilates, gym-like activities may be okay a couple of days later after when they go back to their country, but football, basketball-like activities are not allowed, of course, for 2 months. And also heavy exercises shouldn't be done for the first week.
And the swelling, how long the swelling stays? The heavy swelling with bruises, maybe you see it on your patients, and the slight swelling.
Patients will have slight swellings. We haven't seen too significant swellings so far. Of course, it's quite normal having slight swellings for a couple of weeks, couple of months. It depends on surgery, patient's skin condition or general condition. But normally, a couple of months later, majority of swelling will disappear.
And when the patient is working with other people and needs to have a representative look, when he can go back to the work?
Normally, when they go back to their country, they may go to work.
So it will not be very visible that they did the surgery?
Yes, but after 10 days, they will remove the second cast. The metal cast I personally prefer. We are changing the cast when the patient is in Istanbul, but when they go back to their country, they will remove during having their shower. When it is wet, it will come off easily, and then there will be nothing over the nose.
Okay. Will the patient has if the patient has some snoring problem, will the rhinoplasty resolve the snoring problem or not?
Sometimes yes, it may be very helpful if the patient has deviation or if the patient has some collapse, some depressed areas, especially on these sides. Rhinoplasty may be very beneficial for snoring problems. But Especially for snoring is a bit different from daily breathing functional problems. We need to check much more, especially for snoring or sleep apnea patients, sleep apnea symptoms.
I see. Thank you very much, Dr. Cem.
Our pleasure.
Thank you.
Thank you.